Aspirin, also known as Ecotrin Tablet, delayed release, Enteric Coated, is commonly used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It may also be used to reduce pain and swelling in conditions such as arthritis. Aspirin is a salicylate and a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking a certain natural substance in your body to reduce pain and swelling. It is important to consult your doctor before giving aspirin to a child younger than 12 years old. Your doctor may recommend a low dose of aspirin to prevent blood clots, reducing the risk of stroke and heart attack. If you have recently had surgery on clogged arteries, such as bypass surgery, carotid endarterectomy, or coronary stent, your doctor may direct you to use aspirin in low doses as a blood thinner to prevent blood clots. When taking Ecotrin Tablet, delayed release, Enteric Coated, it is best to follow your doctor's instructions on the dosage and timing for optimal benefits. When using Ecotrin Tablet, delayed release, Enteric Coated, for self-treatment, be sure to follow all the directions on the product package. If you have any questions, consult your doctor or pharmacist. Remember to take the medication by mouth with a full glass of water, and do not lie down for at least 10 minutes after taking it, unless otherwise directed by your doctor. If you experience stomach upset, you may take the medication with food or milk. It's important to swallow the Enteric Coated tablets whole and not to crush or chew them, as this can increase stomach upset. The dosage and length of treatment will depend on your medical condition and response to the treatment. Always consult the product label for recommendations on the number of tablets you can take in a 24-hour period and how long you may self-treat before seeking medical advice. Do not exceed the recommended dosage unless directed by your doctor. If you are taking this medication for self-treatment of headache, seek medical help right away if you experience trouble speaking, weakness on one side of the body, or sudden vision changes. Be cautious with the use of this medication for self-treatment of pain or fever, and do not use it for longer than 10 days. Remember to consult a doctor if your condition persists or worsens, or if you develop new or unusual symptoms. Always contact your doctor promptly if you suspect you may have a serious medical problem. If you experience upset stomach or heartburn, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. Some serious side effects to watch for include severe or persistent nausea/vomiting, easy bruising/bleeding, difficulty hearing, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing eyes/skin. If you notice any of these, it's important to contact your doctor right away. In rare cases, this medication can cause serious bleeding from the stomach/intestine or other areas of the body. Seek medical help immediately if you experience severe or persistent stomach/abdominal pain, black/tarry stools, vomit that looks like coffee grounds, trouble speaking, weakness on one side of the body, sudden vision changes, or severe headache. It's also important to be aware of any signs of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any of these symptoms, seek medical help right away. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed here. It's important to discuss any concerns or questions about the use of this medication with your doctor and to follow their instructions carefully. Before taking Ecotrin Tablet, delayed release, Enteric Coated, it's important to talk to your doctor or pharmacist about any allergies you may have to aspirin or other pain relievers. Also, consult with your healthcare provider if you have any bleeding or blood clotting disorders, kidney or liver disease, stomach problems, asthma, nasal polyps, gout, or certain enzyme deficiencies. It's important to limit alcohol and tobacco use while taking this medication, as it may increase the risk of stomach bleeding. Be sure to inform your doctor or dentist about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Children and teenagers under 18 years old should not take aspirin if they have chickenpox, flu, an undiagnosed illness, or have recently received a vaccine, as it may increase the risk of Reye's syndrome. Older adults may be more sensitive to the side effects of this drug, especially stomach/intestinal bleeding and ulcers. Aspirin is not recommended for use to treat pain or fever during pregnancy. Women of childbearing age should talk to their doctor about the benefits and risks of using this medication. Aspirin can pass into breast milk and may harm a nursing infant, so it's important to consult your doctor before breastfeeding while using this drug. If your doctor decides that you need to use this medication during pregnancy, they will determine the lowest effective dose for the shortest possible time. In some cases, low-dose aspirin may be used safely during pregnancy to prevent certain conditions. Talk to your doctor for more details. It's important to be aware of potential drug interactions when taking Ecotrin Tablet, delayed release, Enteric Coated. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Ecotrin include mifepristone, acetazolamide, blood thinners, such as warfarin, heparin, corticosteroids, such as prednisone, dichlorphenamide, methotrexate, valproic acid, and herbal medications, such as ginkgo biloba. If you have recently received certain live vaccines, consult your doctor before using this product. It's also important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers known as NSAIDs, nonsteroidal anti-inflammatory drugs such as ibuprofen, ketorolac, naproxen. To prevent an overdose of aspirin, be sure to read the labels carefully before taking other pain relievers or cold products to make sure they do not contain aspirin. Daily use of NSAIDs, such as ibuprofen, may decrease aspirin's ability to prevent heart attack/stroke. If you are taking low-dose aspirin for prevention of heart attack/stroke, consult your doctor or pharmacist for more details and to discuss other possible treatments, such as acetaminophen, for your pain/fever. And remember, this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you use this drug. If you or someone you know has taken too much Ecotrin Tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Symptoms of overdose may include burning pain in the throat or stomach, confusion, changes in mental or mood, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. Always seek medical attention if you suspect an overdose. If you use Ecotrin Tablet regularly or at high doses, you may need to undergo lab and/or medical tests to check your liver/kidney function, blood count, and salicylate level. It's important to keep all medical and lab appointments. Consult your doctor for more details. There are many different aspirin products available, some with special coatings and some are long-acting. It's best to ask your doctor or pharmacist to recommend the best product for you. If your doctor tells you to take Ecotrin Tablet on a regular schedule and you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Don't take a double dose to make up for the missed one. When storing Ecotrin Tablet, delayed release, Enteric Coated, make sure to keep it at room temperature and away from moisture and light. Different brands of this medication may have different storage needs, so be sure to check the product package for instructions on how to store your specific brand, or ask your pharmacist for guidance. Avoid storing it in the bathroom and do not use any aspirin product that has a strong vinegar-like smell. Keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.